Hi, my name is Dr. Lisa Schwartz. I'm an associate professor in the Department of Biomedical Laboratory Sciences at the George Washington University. And today I will be discussing an advising service that I implemented for students in a primarily online student population. Here are the learning objectives. I'm hoping that you'll walk away from this presentation having a better understanding of some of the challenges that are inherent in advising students who are enrolled in an online academic program. Explain at least 3 strategies that I've implemented to try and address these challenges, and also to discuss to date what the impact of these strategies have been as measured by online student satisfaction and their engagement with the resources that have been put into place since June of 2019. So to provide some context, the Biomedical Laboratory Sciences Department at GW is based in the School of Medicine and Health Sciences, and it offers numerous undergraduate, graduate, and post-baccalaureate or post-bac programs. Nearly all are conducted fully online. Undergraduate programs are typically bachelor degree completer programs where most students first completed their associate's degree at a community college before joining GW. Most but not all core science prerequisites are part of the bachelor's degree program's curriculum. The post-bac certificate program are undergraduate courses, and the master's degree is at graduate level, and either one may serve as record enhancer programs as well as offer a valuable credential in the healthcare field, particularly for students who may need to attempt to apply multiple times to a health professional program after completing their degree at GW. As I noted, it's a highly diverse student population. A significant percentage are from underrepresented minority populations. Many are first-generation college students. Many were previously or currently serving in the military, and the vast majority are working professionals, often with family obligations. And these are very similar challenges that align with those that were noted by Arablo in her article in 2016. So anecdotal evidence from faculty in the department had shown that numerous BLS students had expressed interest in pursuing a health professional degree, like medicine or physician assistant, or a graduate program like a PhD or doctorate in clinical laboratory sciences after they completed their BLS program. And as we all are well aware, the admissions process to these programs is complex and time sensitive, and BLS students may not be aware of missing prerequisite coursework, multiple resources that are available to assist them in their applications, and the very strict timelines that are often associated with them. BLS students may be seeking clinical and/or research opportunities to make their applications more competitive, but this may be more challenging given that they are often attending school while working part-time and raising families. And although the BLS department offered high quality academic advising regarding course of study and graduation requirements, it was decided that the BLS students may really benefit from high touch advising while they're considering their options and going through the application process for health professional program applications. So before launching the service, a survey was distributed to all BLS students in June of 2019. There were 66 respondents, and interestingly, they were equally divided among the bachelor's degree students, the post-bac certificate students, and the master's degree students. Among them, 64% of the bachelor's and post-bac certificate students and 35% of the master's students were very or extremely likely to apply to a health professional program after completion of their BLS degree or program. Most were looking at medicine, although a significant number were also considering physician assistant programs or a doctorate in clinical laboratory sciences, which is a really rather new field with very few programs in existence. And they could choose within the survey multiple fields or disciplines. The vast majority were very or extremely likely to participate in a pre-health professions advising service if offered. And these services included information sessions about specific health professions as well as the application processes for them, webinars about healthcare issues, assistance during the application process, including writing of personal statements and review of activity sections and interviewing skills. Other requests in an open-ended question included MCAT prep courses, internships, and other opportunities specifically for distance learners. So with that information, the BLS PPAS was formed. Being that it's a primarily online program, it was embedded into a online learning management system used by GW, Blackboard, and the resources on general advising as well as applications to numerous types of health professional programs and graduate programs are included. There is an opportunity for students to join an email list at which regular announcements are sent regarding virtual health professional school and program fairs, as well as a calendar of regional and national events. Special events have been set up, including a resume workshop, and students are able, through the online community, to request a one-on-one consultation, in which I would get a summary of their interests that I obtain using an intake form, and also they would use a Calendly link that would show the availability of when they could set up the one-on-one consultation. When I'm alerted that someone has completed that form and chosen a particular date to have the consultation, I then am able to reach out to them directly with WebEx information. They also, as part of the program, for those students who have at least 3 one-on-one consultations during the course of the time that they're in the program or shortly after graduation, the program would provide a composite letter packet for them or assist them in developing letters of recommendation. So this is what the online community looks like in Blackboard, and as you can see on the far left-hand side with the red arrow is where the tab for the BLS PPAS is found. Once you click onto that tab, then they are first brought to a general page of announcements, a calendar, a link where I put information about national events as well as, of course, local events. They are also able to join this email list so that they receive announcements directly in their email. There's also a folder that is a general advising information. And within that, there are a number of resources for students who are just trying to get a little bit more information about different health professions in general, as well as see what coursework they may still need that was not included as part of their BLS program. And then there are multiple tabs for a number of different health professions, including, of course, medicine, physician assistant, physical therapy. And within each of these folders, students will find specific information about any central application system or CAS that's available for those programs, links to the national organizations that list those particular programs, as well as other resources. So in mid-January, or in January, which was about mid-year, 6 months after the program was launched, I put out a survey to the whole population of BLS students to get a sense as to their interest and use in the online the pre-health professions advising service. I only got 21 responses, and at that time, only about 50% of the students had even utilized the resources. So just doing this survey actually alerted a lot of people to the service that they were otherwise not familiar with. And as you can see, most students, or a significant portion, were not even aware that the service existed. They weren't sure how to utilize it, and they weren't quite sure what the value may be. Very few felt that they didn't have time to utilize the service. And a small number who completed this survey were actually not interested at this time to apply to a health professional program. Now, to date, another 6 months following, I continue to post a number of announcements and resources in the advising tab of these communities. And I should note that the undergraduate, bachelor's degree, and the post-bac certificates are in one community, whereas there is another community for specifically for graduate students. So everything that I do has to be done duplicate, because students can only access the community that they are in. But to date, I've had 21 one-on-one consultations with 14 students. Therefore, of course, some I've met with more than once. Of those, 4 were within the blended bachelor's degree program, which are more local students. So they were able to come physically to campus, although some still elected to do the one-on-one consultation through WebEx. 6 were in the bachelor's degree that it's online, so they may have come from anywhere in the country. 5 were master's degree students, and 1 was a post-bac certificate student, and they were all located at a distance. Some were in Florida, in Texas, in Arizona, in Massachusetts. 22 students across all of the different programs signed up to be added to the email list. And 1 student who was in the bachelor's degree program, the blended program, despite not being successful prior to the service being initiated in applying to medical school, she actually this year applied to multiple pharmacy programs and received multiple offers. Just to put some other things into perspective, since March of this year, I added a particular folder of COVID-19 announcements, and that since March has received 175 hits from among the students who don't necessarily have to be members of the email list or have met with me one-on-one, but any student in the program was welcome to participate in using the online resources as well as get these type of announcements. This is just a pie chart just showing within the entire online communities, both the undergraduate and the graduate and post-bac certificate communities. You can see here with the blue arrow is that the pre-health professional advising tab is getting a rather large percentage of the various content areas within the online community, and that is true for both the undergraduate community as well as the graduate community. And there are ongoing efforts to ensure that any student who is planning on applying to a health professional program following graduation of the BLS program are aware and are able to take full advantage of this service, and therefore to make it more visible, I created and added a module on the new student orientation for both the undergraduate and graduate students, as well as post-bac certificate students. I continue to send a bi-weekly email to both lists, just keeping those who have requested the service engaged. For those students who I had a one-on-one consultation, say in the fall of 2019, I have recontacted them, and a number have responded and set up second consultations so that I can ensure that they get ongoing support. I also plan to offer an information session regarding health professions in general, as well as the application process, probably in the fall. And I would really welcome any of your suggestions or ideas as to how to improve this new service that has been really rewarding, because these students, particularly for all of the different challenges that I noted in earlier slides, are really very, very thankful to have the opportunity to get these resources really at their fingertips and to have that one-on-one high-touch advising that otherwise hadn't been available. Some of them who were pre-med, after consultation, learned about other health professions that may better meet their needs and for which they may be more competitive. I also was able to connect a number of students with internships and other opportunities, both locally to the DC area, but also nationally. So it's definitely been a very rewarding experience for me, and for those students who have utilized the service, they too have very good feedback. So these are just some quotes that came in emails to students that I have had an opportunity to work with. But overall, you can see that they really enjoy having the resources, are really thankful for them, and I hope to continue doing the service and generating more interest and more participation. And so, as I mentioned, your feedback and suggestions are really welcomed. I thank you for watching my presentation and hope that you're all continuing to be safe. And sorry that we were not able to meet together in New Orleans, but hopefully in the coming years that will certainly be different. And here's my email address. I, again, would greatly appreciate if you have any feedback and would like to share it with me directly, to do so through my email. Thank you very much again.